the beauty of it, you can also follow people. So you can find out who are your fun clubs, who are people you want to be kept updated. And any organization, any business is now having a Twitter account allowing people to be kept up to date at real time about their developments. Some of it is not quite as exciting, but a lot of it could be quite tremendously interesting. So what about swine flu? Well, you would think people wouldn't talk about swine flu on Twitter, would they? When you do a search, this is a real-time search, you get a bunch of results from people who talk about swine flu or their symptoms, and they want their friends to know about it. And you may think, well, so what? Do we really care if someone is telling the world about having cough and cold? So what? Well, we also thought initially, so what? But we did a small study in a year 2009, and in particular, on this day, something important happened which demonstrated the power of this media. Do you know what happened on 11th of June, 2009? Okay. WHO declared stage 6 pandemics. So this major event, which has been anticipated for a few years, escalated, and WHO declared the pandemic stage 6. Well, the word pandemic is causing a bit of an issue among public members and among media. So there has been a massive coverage of this particular stage change from all sorts of media, as you can quite clearly say, some serious, some slightly less. And it has been obviously picked up by Twitter. We have done a study collecting all tweets containing the word flu. So a very simple study, just searching the Twitter every minute, getting tweets back containing the word flu. In April until the end of the year, how many tweets containing this word do you think we have received? Any guess? 10, 20,000? Millions, yes. So surprisingly enough, we received 3 million tweets from all over the world discussing some kind of aspect of the pandemic or forwarding some of these articles discussing or mentioning the influenza. Some of the tweets also mention the word, I have the swine flu or I have the flu. So some people actually wanted their friends and followers to know that they feel they have the disease. So we look at these particular tweets, calling them self-diagnosing tweets, even though some of them obviously do not have to actually have the disease, and linked it to the Royal College of GP Surgeon data and compared what the surveillance data from GPs actually told us about number of cases in the UK last year and what the Twitter discussions was about. And we could tell, as you can tell from the graph, that the Twitter discussion slightly anticipated the surveillance reported data. So in a way, and obviously it was a special case, the pandemic was a very sort of publicly aware event, the Twitter discussions in this large quantity, even though with the noise, which is part of it, can actually predict the pandemic up to a week, in this case, before the official surveillance, which is important to know for the authorities, for preparedness, for organizations like WHO, ECDC, and the HPA. So what next? Well, you have all this media coverage, all these events, and they are being spread in all those networks, and followers who are following celebrities or even any one of us can also be aware of what we are trying to say. This could be all monitored and evaluated. Also, we looked at the media relation with the Twitter, thinking, well, is it the people talking about having a flu and then the media pick it up because there's an outbreak? Or is it the public being aware of the upcoming influenza from the media coverage and all these scare stories, and then they talk about it? What is the correlation? Well, it kind of shows that because it is almost real time, we couldn't measure any significant time lapse. So the peaks in the media coverage kind of correlate to the peaks in the discussions on Twitter. Also, you can use this media to engage in some risk communication or hard-to-reach groups. So we thought, well, it works for Twitter on swine flu. This is a public-aware topic. What about STDs? Well, you can tell even STDs are being discussed on Twitter in a quite fine range of detail. So risk communication awareness of patients who perhaps could be followed, just like those cyclists, and being told about the nearest GP, nearest free services for STDs patients could be also used on Twitter. We can also use it for some targeted health communication and use the mobile devices for monitoring patients and getting the information from them. So let's follow those who mention, for example, having some vomiting virus next year during the Olympics in London, people who may not be able to access a GP and our services, and try to approach them with quality information how to receive medical care. And finally, it's not just about developed world. This picture is from a small Ugandan village where I was a couple of years ago doing some charity work, but there was no running water. This girl is carrying water on a daily basis to the village. But a lot of people in rural conditions in a poor country like Uganda actually had mobile phones. So the penetration of the phones is much higher in a developing world than it is in access to the actual wired internet. So using this media opens a new sphere and tries to bridge the so-called digital divide. So this is the summary of the aims. Some of you may be surprised what could be achieved using a small device like mobile phones. If you have any questions, you can ask me or you can tweet to this hashtag. I will pick it up and get back to you. You can follow me or you can just email me. Thank you for your attention.
Thanks, Patty. Okay, Bruce, are you a tweeter?
No.
No.
What do you think the real penetration of this technology is in the third world?
The mobile phone penetration in the third world, in some of the richer countries, the data were from Africa as the kind of poorest continent, are up to 90% in countries like Uganda. And I'm not talking about smartphones, it's basically the sort of cheaper range phones. In some poor countries like Burkina Faso, statistics say about 50%. While the internet access is around 4%, it's only in sort of companies, big cities, almost nothing in rural areas. And even in big cities, the trouble is there's such a sort of weak power network. Every time the power goes down, it knocks off the servers. So the internet provision, even in like five-star hotels, is very, very limited. So the phone solves the infrastructure problem the developing world is struggling with and could provide a new potential.